Introducing the novel target tape guidance device, a new method to effectively plan and execute spinal procedures. Traditional localizing techniques begin with the preoperative medical imaging, which allows the surgeon to diagnose the patient and see the target sites. In the OR, the surgeon feels for landmarks and counts the spine's processes. Needles may be inserted along the spine with multiple x-rays taken in the OR, jumping from the landmarks to the target. There are a variety of challenges. The spine is made up of dozens of vertebrae that feel and look similar. Surgeons may request a radiologist to mark the site, sending the patient to radiology beforehand for additional scans. Over half of all spinal surgeons have operated on the wrong level. Being dependent upon feeling for landmarks and vertebra is cumbersome. Studies have shown that palpation is only 60% accurate. This may cause larger incisions or even wrong site surgery. Atypical anatomy, such as missing the 12th rib, exacerbates the localization. In the OR, fluoroscopy's limited view may make catching these anomalies more difficult. When using needles in the OR with x-rays to find vertebra, the surgeon commonly has to insert several needles in the back, jumping between multiple x-ray images. This not only increases infection risk, but also radiation exposure to everyone in the OR. These challenges are compounded the further the target is away from the sacrum landmark, such as the upper lumbar and thoracic regions. Target tape is a simple solution to allow surgeons to more easily and quickly localize their incisions with accuracy. Target tape is a large adhesive grid that is adhered to the patient's back. An X-ray is then performed. This may be a CT, plane, or fluoroscopic image. The grid appears on the X-ray. The coordinates of the target can then be determined. The top layer of the tape is then removed. A bottom skin film layer is left behind on the patient. The grid pattern is also printed on this film. There are large window openings exposing the skin. The surgeon simply marks the skin at the target coordinates. The skin film is then removed, the patient's skin is prepped, and the incision is made. For further redundancy, a metal marker can be placed internally at the vertebra with a confirmation X-ray taken. The following video demonstrates the use of the device. The localizing X-ray can also be performed with a single large plain film, which is more effective than the limited fluoroscopic view. The large image can also be directly correlated visually to the preoperative CT or MRI to verify the target site. Studies have shown that a grid guide with X-rays can reduce lumbar incisions from 5 to 10 centimeters down to 3. Target tape may mitigate cancer risk since the surgeon no longer has to do repeated iterations with X-rays. There are key advantages for minimal invasive surgery with multiple sites. Instead of taking numerous X-rays and performing localizations for each incision, target tape allows the surgeon to easily map out all the sites with a single image. Target tape can significantly benefit thoracic and upper lumbar cases, since the surgeon no longer has to jump along with numerous X-rays. The previous methods highlight the use of target tape in the OR. The device can also be utilized with imaging beforehand in radiology, as demonstrated in this video. Target tape is applied to the patient in radiology. 4 skin markings are made through anchor point holes. These skin markings remain on the patient until their surgery. At the time of their procedure, target tape is applied again, leaving behind the skin film for the surgeon to use when marking their incision. This method reduces X-ray exposure in the OR and saves time. Moreover, target tape may even be used on the pre-op CT, allowing for direct correlation to the target, increasing accuracy and redundancy. In the OR, the incisions can then be made immediately without delay. Target tape can allow for fast, easy, accurate procedures, which aligns to the goals of hospitals. Eliminating the unnecessary iterations of intraoperative X-ray may save the time equivalent of $585. Moreover, if there is a reduced redundancy on radiologists to mark the sites, there may be savings of over $400 per case. Target tape simplifies complex localizations that may allow the surgeon to perform the marking themselves. More efficient surface site localization is beneficial for a variety of surgical procedures beyond spinal. Smaller sizes will become available that may be useful for orthopedic trauma, such as on legs and arms, as well as other types like thoracics and vascular. Thank you for watching this target tape demonstration. Please contact us if you're interested in product samples. We'd be happy to discuss target tape with you.